All right. Well, I think as everybody's coming in, I'll say good afternoon. Thank you all for giving up your lunch hour or planning your lunch hour around our presentation. I'm Kelly Edwards from Clinton Human Services, and I'm gonna get this ball rolling. We know your schedules are really tight, so we're gonna give you a bunch of information, and we will follow up by sending you a recording of this lunch and learn. And we will also email some helpful materials right after the presentation. Can we start the next slide? So just a quick bit of background. Several youth service bureaus, human service bureaus have been collaborating over the last several months, talking about and learning about the issues surrounding legalization of marijuana in Connecticut. We've been working really hard to learn what we can to be able to share with you what would be pertinent to your boards and your positions. And we're excited to be able to share with you some that we've learned today. And the list of towns that have been working on this and which are presenting today are listed there. Okay, what we are going to cover today in a short span of time are these 5 points. We are going to cover some information about why marijuana is very harmful for young people. Concerns with Senate Bill 888, which is the bill that the governor has authored to legalize marijuana in Connecticut for adults. We are going to share with you some of the impacts fiscally for our towns, some things that are being touted and some realities that we have learned from other states. We have had a couple of our communities already approached by marijuana brokers, I guess you could call them, people looking to have businesses. So even before this bill has passed, the marijuana business people are out. They are asking for zoning considerations and things like that. In fact, Colchester is one of our communities that we're aware that this happened. And then we have some action items and some next steps for you to consider moving forward from today. So there's a lot of different pieces to this marijuana issue, and the 3 of them are listed here on this slide. There's a lot of talk about decriminalization and having lesser or no penalties for adults that have been arrested. There is medicinal use, which we know has been passed as legal in Connecticut a couple of years ago. And then there's the legalization of marijuana for adult use. A lot of people call it recreational use, but since that term implies that it's a whole lot of fun, and we know that it's not just a whole lot of fun, that there are a lot of other issues to consider, we're just going to call it legalization of marijuana. And that 3rd piece is what we're talking about today. We are not looking to talk about criminalization, decriminalization, or the medicinal use. Okay, so briefly about the bill before we turn this over. The bill is Senate Bill 888-6457. It was originally authored by Governor Lamont and a team of his staff. So he is really pushing for this to pass through. There's a lot of pieces to it that we're going to go over with you today. It's been rewritten several times as it's moving through the Senate. Recent feedback from Connecticut SAM, which we are going to hear from today, we're going to hear from SAM National, is that legislature may end up going into special session on this bill. Session is supposed to close on June 8th. Nice. In the last 24 hours, there have been advances towards the bill passing that we've become aware of. So I feel like it's really imminent. So this is a very timely discussion that we're able to have with you guys. And as I already noticed, some communities have been approached to create these floating zones. I don't know, Val from Colchester, do you want to make a quick comment about what you guys have experienced?
Well, I would just say that our planner is on the call today as well. I guess what I would say is that these types of processes are brought to the table without the other, sort of side of the story. And while I understand that, planning clearly has a different sort of perspective than the Youth Service Bureau would, without knowing that that was on the table, we weren't able to voice our concerns related to it, because I wasn't looking for that. So I think that that would be sort of my advice to everybody else, is to be on the lookout for that creeping into your own communities.
Great. All right. Thanks, Val. So at this point, I'm going to introduce our partner in all of this from SAM National. SAM stands for Smart Approaches to Marijuana. Marinas Rodriguez has been working with us for the last couple of months. She's extremely knowledgeable, and she's going to give us a little bit of background based on what other states in our country have learned from their legalization. Marinas, take it away.
Hi, everyone. Good morning. I'm just going to go ahead and share my screen.
Okay. All I want to know is about the zoning thing.
Hi, good morning. So again, my name is Marinas Rodriguez, and I am here from SAM. SAM quickly promotes an evidence-based approach to marijuana policy that prioritizes public health, just to be clear on that. And I am based out in New York, and recently New York has legalized marijuana for recreational purposes. And with working amongst other CT allies, I've seen what not only is done nationally to states that have legalized, but also what is done in my community, and the misunderstandings that are already going on that pose serious issues when it comes to social equity. And as a person of color from an impoverished community, I know that it affects us even more. Something that, as Kelly discussed, that we've recently found out is that there is coming together, it seems, when it comes to legislation and the bill with social equity. However, there's a lot of misinformation around that, because what happens is that often the states that have the most fierce agenda of social equity fail at the highest level. For example, Illinois, they actually wanted social equity to be their #1 priority. And to this day, they've made millions of dollars on marijuana revenue, and not one African-American person holds a license in their state. And looking at your community with pot shops, there's a rise in crime rates in communities with recreational and medical dispensaries as well. And we often hear that we want to help people that have suffered from crime rates when it comes to selling drugs or using drugs in impoverished communities and in communities with minorities. But how is that going to help these same communities when rising crime rates will continue? Also, there's an ease of obtaining that tends to increase. And there are studies that say that youth who engage with marijuana promotions through social media were actually 5 times as likely to use marijuana. Social media platforms like Instagram can actually promote through zip codes. And we'll talk a little bit about impaired drivers and decreased road safety. So what we want to really emphasize is that this is not a solution to social injustice and to systemic racism. And also, we want to encourage that while we have the opportunity, that communities are clear that they should opt out if legalization was to come. Looking at states where marijuana was legalized for recreational purposes, in Colorado, the calls to Poison Control Center increased by 112%, in Massachusetts 140%, and in Washington 103%. States that legalize marijuana often have high levels of pesticides and mold. We often speak to bud tenders, which are your bartenders, like in a bar, except these are your servers in your pot shops. They report stories where their business owners and their bosses that have licenses encourage them to just wipe off mold, to resell the marijuana that they know has high levels of pesticides, And we also know that when we talk about legalization, we're talking about commercialization. Your same people that have suffered in the war on drugs are not as easily going to get licenses. And they're not necessarily going to be able to have capital as much as your tobacco and alcohol industry will have in order to open their pot shops. We're looking at drinks, candies. We're looking at devices that are not detectable. When we look at the option of treating marijuana like alcohol, we're looking at how many DUIs there are. In 2017, alcohol-related crimes and arrests were 1.3 million, and 700,000 were actually marijuana-related arrests on the road. So legalizing is not going to help this. Again, there are tales of there not being one social equity licensing program yet. And fewer than 20% of all marijuana businesses nationwide are owned by minorities. And only 4% of all marijuana businesses are actually owned by African Americans. And in states where legalization occurs, the Black market actually increases. And an example is an article that was written in the New York Times where they mentioned that it gets worse, not better. In 1992, we had 900,000 people using 12 years old and up. And years later, now we have an average of 9 million. And on top of that, we're not talking about the same potency marijuana. We're talking about ultra potent marijuana. Looks like this, for example. It's not your Woodstock weed. A joint and marijuana plant in the 70s, 80s contain on average less than 2% THC. And in the 90s, it started increasing slowly up to 5% on average. Today, your average marijuana plant has 12% THC. And when we're talking about THC concentrates, which we're gonna look at like this, we're talking about THC concentrates that go up to 99%. And in this bill, there are no THC caps, which is extremely important. So you're leaving the amount of THC that's going to be consumed by the community in the hands of your servers, which are often 18 years old, young, are focused on making money, on making sure the business is running well, especially in the pandemic when there's so much economic crisis in restaurants, bars, as well as coming to be pot shop industries and stores and consumption sites. We're looking at items like this that parents and people can't really recognize. We're looking at gummy bears, we're looking at your Kit Kat, your lollipops, we're looking at medical cannabis candy. And again, when we look at potency, in 2008, for example, your marijuana plant potency was 8.9%. And as of 2017, it was 17.1%. And when we look at concentrate potency, that climbs even quicker. In 2008, your average concentrate potency was 4.7. And as of 2017, it was 55% on average. And that does not include so many youth that report of use is from 65 to 99%. We're talking about your green crack, your earwax, your butane hash oil, your hash oil capsules, your butter, and your shatter, with THC contents, again, up to 99%. And we've heard from our former US Surgeon General that said that this isn't your mother's marijuana. The marijuana today is significantly potent, and a lot of people don't know that. Often, even your adult that's going to be using legally is looking to actually just have a good time. They may not expect that their edible or their concentrate is not going to hit them until 90 minutes later. They get in the car, or they might consume something else at a party in the meantime, and you have a health hazard on your hands. Daily use among 12th graders is also rising dramatically. And the near daily use of marijuana by 12th graders continues to increase. From 2018 to 2020, we see an increase from 5.8% to 6.9%. And the prevalence of marijuana use disorder in children 12 to 17 has been shown to increase 25% after recreational marijuana legalization in their state. And I will be sending a link to a report that will source a lot of this data. And according to Monitoring the Future, 1 in 4 12th graders will try marijuana or increase their use of the if marijuana were legalized. And often we hear, when I speak to marijuana industry people, they will say that we're not promoting marijuana. We don't want people to use anymore. We just want it to be legal. And commercialization does not have to exist in order for criminal penalties to be removed. And when we look at regularly high potency marijuana, users are five times more likely to develop psychosis, especially during a pandemic, where globally it's known that whenever there's a crisis in a community, substance use increases as well as mental health issues increase. And we're talking about not just open situation where people are free to use and consume, but we're talking about advertisements and targeting youth. You'll see things like this, like show your ski pass and receive a $1 joint. We're going to see different methods of appeal to children, even shows like Euphoria, that although it's teenage actors and younger adult actors, it's targeted at young people. And if you watch just one episode, the amount of vape products and marijuana and other drug consumption, as well as on different social media platforms by celebrities, is intense. Advertisement does increase, and it exists, and it's going to get worse, as well as commercialization. Again, we're looking at different ways of advertisements, of advertising to youth. And we all know that what happened with the tobacco industry. We saw Joe Camel. We now have different marijuana brands trying to use the same model, as well as marijuana companies promoting marijuana swag, cannabis swag, to young people. They might use a label like Supreme and put their marijuana brand on it and distribute it to kids. THC vape companies are also using cartoon characters, video game characters to advertise on social media, and they're also targeting Comic-Con, which is popular again amongst young people. And there was a 400% increase in marijuana poisonings of children 0 to 9 age in 2019 in a Colorado health report. And it was also reported that 23,009 homes with children are not storing marijuana products safely. And when we talk about a pandemic and we are looking at delivery of marijuana and we now have no contact delivery, how exactly is it going to be that this marijuana is going to be verified to be served to someone that's 21 and over? How is it that is it going to be just dropped off in front of the door where children are able to pick it up and consume? And again, often you may have your adult that just wants to consume responsibly and legally, but all the health implications and the risks that comes with aren't always predicted. Often pets and children consume these edibles and these THC concentrates, unfortunately. And marijuana hospitalizations have increased 101% in Colorado since legalization, and in Alaska by 45%, as well as auto insurance increases when we look at legalization in states that legalize marijuana for recreational purposes, not just medical. So these are the different marijuana and vape industries that are linked. As you can see, this is more about money than it is about social equity and helping people of color and disenfranchised people. The marijuana vaping crisis was also responsible for deaths, and some of these were sold in commercial shops. And in states that have legalized, your revenue is less than 1%. Colorado actually has the most revenue, and it's actually only 0.78% of their total revenue. And I want to go to a statement from AAA. They oppose the legalization of marijuana for recreational use because of its inherent traffic safety risk and because of the difficulties in writing legislation that protects the public and treats drivers safely. Marijuana impaired driving fatalities are skyrocketing in states like Washington and Colorado. They have more than doubled since legalization. And in Oregon, 50% of all drivers assessed tested positive for marijuana impairment after legalization. We've heard concerns from business owners and, for example, like construction unions, because of the risk that this actually poses, because a lot of employees may self-medicate with marijuana And how will this be resolved once it's legal for recreational purposes? Because it's not an easy test like a breathalyzer. And as we know, when you test the blood for marijuana, even if you consumed days prior to an incident, it can come up in your blood, and that's hard to prove in criminal court, and it poses a lot of other issues. And 1 in 5 drivers are stoned in Washington, and that's up from 1 in 10 prior to legalization. So we have something up with that. And if possible, we want to advocate for opting out in advance, and to make sure that you all know how important it is to make sure that we don't create another problem while trying to resolve a social equity problem. We want to make sure that edibles and THC concentrates are outlawed and severely restricted, that the marijuana industry should not serve on rulemaking bodies to determine regulations, that pot advertisements and promotions are prohibited, and that there are science-based public awareness campaigns that are implemented across multiple media, as well as drug driving prevention being a priority. I'm going to stop my share there. And I want to emphasize that, for example, in New York, I still speak to a lot of communities, and there's so much misinformation about how is it legal to consume, and people say, oh, it's the same as cigarettes, but it's really not, because it's legal to smoke a cigarette in a car, but it's not legal to smoke a joint. And who's more likely to get pulled over when driving? People of color. And these are the same people that these laws are supposed to help. Something else that's misinformed is that it's legal now, but technically all marijuana in New York is illicit, because the only marijuana that should be legal is the marijuana that's sold through New York, and licenses for selling are not legal for at least until the next year because of the time it takes. When I speak to my legislators in New York, they don't even know what that will look like, what the system will be. They have a checkpoint system that they've planned, that if in a year or two things aren't working out as they expected with social equity, they're going to go back and go back to the drawing board. So I just want to just make sure that there's no rush in something that is not easy to undo. When we look at states like Colorado, they're now looking to introduce THC caps because they saw that just allowing a free market of marijuana has not been beneficial to them or their community. And they're now looking to introduce THC caps, and it's a lot harder to undo something that's already done than it is to prevent an issue and to take your time to make sure that things are done right. I've taken up a lot of time, and I really appreciate it.
So thanks so much, Marinas, for the national perspective on the issue. I'm going to talk briefly about our local community public health and our concerns about youth development in particular. And while we know that the proposed legislation is about the sale of marijuana to adults, we cannot deny the realities of the root causes of substance use beginning in adolescence. So the root causes of teen substance use are well documented and predictable. We know that teen drug use is lowest in communities where the perception of risk is high, where the perception of disapproval by peers and parents is high, and where access is low. Clearly, legalization of marijuana is affecting all of those areas of core measures. Youth service bureaus in the shoreline measure all of these factors biannually, and the numbers vary a little bit town to town, but some trends that demonstrate the impact that marijuana legalization is already having on our towns is that youth perceive marijuana to be the least risky substance. That means that fewer youth believe that weekly use presents a great risk to their health and their development. Similarly, they perceive that their parents disapprove far less of teen marijuana use than that of other substances. So fewer youth believe that their parents would think it's wrong for them, for their child to use marijuana. And the perception of peer disapproval is even lower. So in many of our towns, fewer youth report that their friends feel it's wrong for them to to vape or to use marijuana than any other substances. And as Marina showed in some of her slides, the link and the connection between vaping and marijuana use is intentionally easy, so that transition can be made very simply. And we see that all the time. So as you can see on this chart, Connecticut marijuana use rates are higher than national averages. And that's very common in states where the marijuana industry is actively pursuing legalization. So for all age categories, teens, young adults, and adults over 25, marijuana use rates are higher here than the national average. There's a lot of research that suggests that the high and increasing rates of marijuana use prior to legalization are evidence of a cultural shift that's taking place. And that, the states where marijuana legalization is being pursued and actively discussed, that marijuana is becoming more commonplace and less stigmatized. And so residents and legislators are less opposed to legalizing it. And so similarly, all the states that have legalized marijuana fall below the US national average for risk perception. So it's the same attitudes that foster policy change and legalization, foster increased use rates among all age groups. And you can see here that the shoreline towns fall within DMIS regions 2 and 3. And our use rates here are on par with the rest of our state, somewhat higher than Fairfield County, which is region 1, and Western Connecticut, which is region 5. So on the next slide, I just want to talk a little bit about the root causes of addiction and what is most concerning to us as preventionists. So, Connecticut has a low risk perception of harm from marijuana, but that does not actually reflect what we know is true about the impact of marijuana on the brain or the root causes of addiction. So I just want to be clear that marijuana is addictive. THC attaches to cannabinoid receptors in the brain. It alters brain function, so it causes the high and all of the other effects of being high. Trouble with concentration, feelings of pleasure, memory loss, all of, difficulty with coordination. But the other thing that happens in the brain is that the THC also triggers a surge of dopamine, just like any other drug or substance that is used in the body. This is the reward center of the brain, where the feelings of pleasure, of relaxation, of calm, the brain, when it is releasing dopamine due to substance, chemical alteration, they're higher than natural levels of dopamine in the system. And so this is really the root cause of addiction. It's where people are then seeking that level of dopamine once again. And it becomes harder and harder to not use the substance. So contrary to common belief, marijuana is addictive. Most research suggests that at least 9%, if not more, of users become addicted. And of course, that number increases among those who start when they are young. It's about 1 in 6. And those who use daily can be as much as 50%. Folks who are using it daily are addicted. So that in Connecticut, the youth that we are working with at youth service bureaus, the youth in our schools who are using marijuana regularly are well on their way to addiction, if not already addicted. Long-term marijuana users who try to quit, and including young people, often report irritability, sleeplessness, decreased appetite, anxiety, drug cravings, all of the symptoms of addiction that you're aware of. And I think it's just important to say that from marketing to the level of high potency products that will be on the market, as Marina shared with us, it needs to be said that the goal here for profitability is that at each step of the marijuana industry and business model, the goal is long-term drug use and dependency. It's the same thing as with the cigarette and tobacco industry. It's the same thing with the alcohol industry. The most money is made over a long time, repeated use from consumers. So you could say, you know, that we are worried about underage marijuana users, but we're also worried about the future of young people today being tomorrow's marijuana users. So it takes a significant amount of regulation, as Marina shared, to mitigate these effects on health and the well-being of the public, of our residents in our towns here on the shoreline, and youth in particular. And this legislation just does not go far enough. It's great that you're all here today because my colleagues from Old Saybrook and other towns are going to be talking about the role that local control can have in going farther than the state will to protect the health and the well-being of our residents and our neighbors and friends. So, you know, some of the things we'll be talking about are density of retail establishments, the placement of those in a community, constraints on the types of establishments that we would allow in our communities, restrictions on the products sold and the potency of those when the state has none, and restrictions on marketing, advertising, and signage, all of the things that work to normalize and commercialize this product and impact young people. So I'll pass it off to Old Saybrook.
Can you hear me? Thumbs up?
I
Okay.
hear you now.
Did you hear anything I said?
No.
Okay. I'm going to start again. Sorry about that. My apologies. Specific concerns for municipalities related to employment and drug testing. Currently, marijuana is still federally illegal, and employers generally are allowed to have a drug-free workplace and to enforce zero tolerance policies. For municipalities, businesses, and employers in the region, I'm sure they've already worked on updating policies and procedures to work with people who have medical marijuana cards. Currently in the US, 33 states have the opportunity for people to obtain medical marijuana cards, which caused a huge shift in employment and HR regulations within the last 5 years or so. And then locally, with the commercialization or legalization of recreational marijuana, people will need to again revisit those policies and procedures and employment regulations around off work hours usage would still cause a positive drug test the next day at the place of employment. So it's not as clear as some people might think, and it will really take a lot of HR and leadership research and critical thinking to determine what are the best policies going forward. One thing that medical marijuana, the commercialization and legalization of recreational marijuana can cause is that safety issues at work are going to be a concern, and productivity, and potentially morale issues. So some places have a regulation for medical marijuana to be allowed within the workplace, and there's time for people to use that. It may create an imbalance with people who think that that's unfair or unjust. That's just one thing to put out there. For zoning and citing, and I appreciate that Saybrook is on the phone today, local controls can include lower standards, or higher standards rather, for advertising. No billboards, no ads for recreational marijuana establishments. Buffer zones, saying how many feet things can be from schools, playgrounds, etc. And determining for the town leaders on the call, do you want an establishment right on Main Street? If you have heavy foot traffic or any traffic, do you want a marijuana establishment right on your Main Street? Currently, some of the cannabis use selling stores are actually, we believe, placeholders for recreational marijuana stores. And so currently there's one right on the corner of the street where our middle school empties out. And so students between the ages of 12 and 15 are walking by that every day. One of the things that I'd like to refer back to that Marinas and Allison shared is that with no caps on the edibles, the THC that can be in edibles, we've seen an increase in the rate of between the ages of 2 and 9 years old at the emergency rooms for having gotten into what looks like a regular gummy, but is actually a THC gummy, and having high toxicity and needing to go to the ER. And also the 12 to 17-year-olds, the things that they talk about in terms of recreational legalization is accessibility, affordability, visibility, and normalizing the process. So currently, if you have any stores that are selling CBD or any of the other items that we've noticed in our local stores, they put up a lot of signage that is getting people ready to just kind of accept. And people naturally make a connection between CBD and cannabis. So it could be the green and white flag, it could be a picture of a leaf, kind of all touted as a health and wellness product. Municipal tax revenue, there's definitely a misnomer and a misunderstanding for a lot of people related to the revenue that they think commercialization is going to generate for this state. It won't necessarily make it to some of our smaller communities on the shoreline. It will be essentially for reparations to communities most damaged in the war on drugs, heavily impacted by the war on drugs. And there's a disparity between the revenue that is anticipated for this to generate and the social services increase that we're going to see. I think Marina has mentioned the Poison Control Center. So the number of increased police intervention, social services, mental health, and emergency room costs to communities is going to be much higher. And the last thing for zoning and town officials to consider is identifying locations where individuals may or may not consume cannabis. Ultimately, there'll be places that might have a sidewalk cafe or a roving van where people can be smoking right on the street, and that smell will impact other people walking by. And what's the next slide, please? Okay, I don't think that one's not mine, is it? Yes, no? Okay, but some things for our town government to look at. SB 888 allows these commercial marijuana activities. So our town government may want to be looking at where, if something like this was, you were approached to have something like this in town, where would you be able to identify in town that you would allow something like this to take place? Next. I think this might be someone else's slide.
I can talk about it, Heather.
Okay.
So the previous slide, I'm Mary Seidner from Old Lyme. The previous slide, all these activities are allowed under the Senate Bill 888, which is the marijuana bill we're talking about. So not only just a retail store, but also the cultivation, possession, manufacture, all the processing, the growing, all these other parts of marijuana delivery. And it does include mobile smoking lounges. So that cannabis on the left there is an actual bus in Colorado that goes from location to location, a parking lot at a supermarket, and then moves to the next one. So people can buy a ticket and hop on the bus for a while, and it's like a smoking lounge for marijuana. Mobile marijuana dispensaries, such as a food truck. And delivery services. That van there on the right is a delivery service. So delivery is allowed in SB 888. So even if your community opts out of marijuana, this delivery could come into your community and go to a home and drop off their marijuana. Also, we know that the legalization of marijuana in New York State, which just occurred already within a couple weeks, there's a marijuana food truck parked in Central Park, offering gummies and a whole menu of cannabis products. So food trucks are definitely part of this bill.
And one thing to add to that about the vans, Mary, is that local zoning regulations can require those vans be attached to a brick and mortar establishment rather than just be kind of a traveling distribution service.
And SB 888 also allows for personal use. There has been some debate at the Capitol about allowing homegrown plants for medical only. Now they're talking about also for the legal. So that's still unclear to us, but it will be part of the bill for homegrown plants, both indoor and outdoor. And next we've got Durham Middlefield.
Hi, thank you. Some of this has already been talked about, so I will be brief. Heather mentioned in the previous slide some of this information. So marijuana sales tax revenue will never sufficiently cover the costs associated with the negative impact that it creates. And Marina's has this link in here that we were going to be sending you from Sam, explaining all of that. About earlier, bring of $1, bring $4.50 of increased social resources expenses. Again, it was mentioned, so it's police, legal, social services, and mental health. So the local sales tax, let me turn my page here. Municipalities have imposed a local 3% sales tax. Annual audits performed by local tax collectors, they'll have to go in and look at inventory versus profits. I'm not sure that we know whether the towns have the capacity to do this. You know, they talk about revenues that will be seen from marijuana sales. Well, in the bottom part of this slide, you can see where the revenues from municipality tax can only be used for these 5 items: streetscape improvements, other neighborhood development where retailers are located, youth employment and training programs, services for individuals released from DOC custody, probation, parole, mental health or addiction services, and community civic engagement efforts. Let's see. And zoning can prohibit the establishment of many medical marijuana collectives, cooperatives, dispensaries, delivery services, operators, established or providers. Many towns have put zoning restrictions in place. Some are thinking about that. We are asking that you also, when you're thinking about writing these, that you put in legal marijuana in your same verbiage. Heather, I think maybe you could jump on and tell a little bit about what happened in Old Saybrook
Sure.
around zoning.
Sure. And Guilford was also successful in placing zoning regulations to deny dispensaries in their town. But about
Well, it's
2.5
Clinton.
years ago, Clinton, thank you.
Yep.
2.5 years ago, a dispensary, someone came to propose a dispensary here over in Custom Drive near the Department of Motor Vehicle. And there's a large turnout by public health concerns and citizen response. And it was successful in denying that application at that time. But Saybrook, like many of the shoreline towns, were so conveniently located near 95. And we actually, we're really in a perfect location for increased distribution of these items. So it's important that we get public education out there.
Hi, I'm Dina Missinello, and I'm the prevention coordinator, along with Betsy at Durham Middlefield Youth and Family Services, along with the Local Wellness Coalition. And going off the zoning and different things that are allowed and are not, we just wanted to show some lessons that we might need to take from Colorado. 71.5% of Colorado bans retail marijuana, and those are all the green zones here on this. And that's just very important because they saw they needed more time to learn from states that didn't, or that allow it. California is also huge. I was amazed by just the plain old fact that 2/3 of California has opted out. So a state that has legal marijuana, 2/3 of them have already opted out of that. Very close to home, our hat on Connecticut is Massachusetts. Very important to see that all of the blue and pink areas in that map, most of the map, have said a total ban, again, right above us. And then everybody else in the gray, green, and gold zones, they have put in those important zoning regulations that we have talked about. So as you can see, we ask you to please consider the opt-out option, which would be most important, as we've seen from many of other states that they have done, or banning on a local level, or also putting zoning laws in place. This will help keep our youth, the most vulnerable population that we have in our community, safe. So a couple other reasons to opt out is the normalization that others have talked about of legalizing marijuana. We want to stop that normalization, because while kids leaving school at the end of the day see a marijuana store across the street, they are normalizing every day that marijuana is safe for them. And we would like reasons like that to be an opt-out. Again, these were talked about kind of in the past. The placeholder establishments, we don't want them to turn into retail marijuana stores, and we want to avoid the negative impacts on youth. And then now I'm going to turn it over to Tony and John from East Haddam to talk some more.
Hi, I'm Tony McCabe. I'm the Director at Youth and Family Services in East Haddam. John is my colleague, and we're going to kind of bounce back and forth a little bit to discuss some of the local controls that we would ask you to consider as you go forward in trying to take on this issue of legalization of recreational marijuana and its impact on our communities. While clearly we are advocating for opting out or a complete ban on commercialization of recreational marijuana in our communities, we recognize that that may not be possible in all situations. And if that's the case, there are other things we would ask our leaders to consider in going forward to protect our kids and our families and our communities in general. One of those things is zoning. It's been mentioned in a couple of other slides from other presenters. What we would ask is that we have the strictest ordinances possible to safeguard our communities. For example, with zoning, have zoning regulation, land use and zoning regulations that include buffer zones around sensitive areas. And by sensitive areas, we mean schools and recreational facilities, parks, youth service agencies and youth centers, places of worship, our municipal offices, residential areas, anywhere where we are going to see youth and family congregate. Child care centers, we need to consider those as sensitive areas. And when we look at buffer zones, you know, the research or what I have read suggests that the industry is going to look for a very narrow buffer zone, maybe around 600 feet or so. What we would ask is that we're looking at least 1,000 feet, that buffer zone be at least 1,000 feet to provide the safeguards that we're looking for. John, I'm going to have you jump in at this point, and then I'll be back.
Sure. So beyond physical location, we can also consider the types of products we're bringing into our community. Edibles are obviously a huge concern here. As you've seen in some of the past slides, they look spot on to name brand candies. They're popular with teens. They vary widely in THC. And all of these things together make them a very, very dangerous product. I believe Marina's had mentioned before the increase, a 400% increase in Colorado for kids 0 to 9 having a marijuana poisoning. And part of that is down to these sorts of edibles. In addition to that, we're looking at trying to restrict high potency THC products. Again, Marina's had mentioned the average cannabis flower might have 12% THC. When you're looking at a product like shatter or wax, you're looking at upwards of 99% THC. This isn't Woodstock weed. It may as well be a whole new substance. So serious concerns for us there. We can also consider restricting signage and advertising. Again, we had kind of mentioned the idea that we don't want to normalize marijuana use for our youth. And part of that is restricting the amount of marijuana imagery that we see in our communities. So one very basic way we can address that is limiting outdoor signage, potentially banning outdoor signage, as well as indoor signage with outward-facing messaging. So for example, a sign facing outward from a window. Beyond that, we can ban specific images like pot leaves. And I believe Heather had mentioned the green crosses in the past, which I personally find very interesting and very concerning because it is sort of that play on the red medical cross. It tries to make that connection of this being some sort of health benefit to you. And again, very concerning when you're projecting that message to kids. And then finally, in terms of signage and advertising, we can ban sandwich boards and flags.
So I kind of looking at my watch here, I see we're closing in on 1 o'clock. So let me quickly kind of say that what we would look for again in terms of local controls is that the minimum age for entry into a retail store should be 21, as is the minimum age for purchase. I'm sorry. We're also looking for the minimum age for employment at any commercial facility should be 21 as well. In terms of hours of operation, the industry is going to push for as much as they can get. They're going to look for 24 hours if they can get it. I think it's important for our communities to try to keep the hours as tight as possible. You know, if we can start out saying, well, we'll go for 9 a.m. to 7 p.m. and then negotiate from there. At the very least, we should keep our hours for this to mirror the hours for alcohol sales.
And just very briefly, in regards to security, local ordinances in other communities where marijuana has been legalized have had a requirement for security guards to be present at the location. And we can take this a step further, actually, by having those security guards mandated to complete a certification program, as well as being mandated to be drug-free themselves. You can go a bit farther by enforcing types of lighting, window covering, and security doors. And then finally, banning the potential of hidden partners, no silent partners. It would allow for more transparency and really let us know who's doing business in our communities.
And finally, some other local controls that we need to consider. There's a lot of this that we really need to kind of take a look at. One is odor control, and that is that we need to hold these facilities responsible for managing the odor that they create, and to institute devices and techniques within their facilities so that those odors do not spread out into the community at large or into surrounding businesses or localities. With regard to licensing, we would ask that we're advocating for the retailer to receive a local permit or license first before going for a state permit. Essentially, what this does is ensures that state law would not preempt local controls. Thank you. I'm not sure who's picking up on the public health needs.
I am. This is Priscilla from New London. I'm with the New London Community and Campus Coalition. Can you hear me? Hello?
Yes, we can hear you.
Oh, okay, thank you. Well, I know we've been discussing and have a lot of information, but really the gist of it is that what I'd like to get across is the fact that if, we're getting to the point where municipalities are forming committees and regarding the marijuana regulations. So it is vitally important that you keep in mind the public health officials and that we have a seat at this table. A lot of the information that has been provided today has come from the public health officials as well as the preventionists who have a lot of this data. So it's vitally important that they be at that table. What some of those constituents should look like at the table, seated, should be people from the law enforcement community. Parents, of course, and having their concerns heard. Educators, zoning specialists, and of course, drug prevention experts. Bringing this issue to the board, is again, from the public perspective is vitally important. So inviting your youth service bureaus to be present as well as your prevention coalitions are one of those people that can also sit and be at the table to really hone in on the real concerns when making these regulations. Education is the key, and the key of education is not just for our communities, but it's also going to be for the lawmakers making these decisions, that they be educated on the ramifications of legalization. And I believe the last slide is just questions and answers. And again, I'd like to thank you for your time and just being a part of this presentation with us.
I think our zoning official from Old Saybrook would like to make a comment. Chris?
Hello, hold on, give me a second. Hi, everybody. Just a few comments on the regulatory side. In Connecticut, we cannot regulate the content of a sign. We cannot regulate the color of a sign. We can only regulate the location and size of a sign. So at one point, someone mentioned, banning some of the content. It's illegal for us to do that through zoning. Another thing was there was a discussion on consumption. Through zoning, we can regulate where something is sold, but we can't regulate where you consume it. So just think about that. Same thing
Christina,
with
can I ask just a quick question? Just
Sure.
like thinking about tobacco and how, smoking has been banned, like say at the Little League field. How did those ordinances get in place if that's not a zoning? Do you know?
I think they're town ordinances that are
Town-
enforced by the police department. So
Okay.
that's where zoning can regulate where something is sold. So you can say marijuana can only be sold in this zoning district if you meet the following 10 things. The building has to be this size or, not visible, whatever it is. But the problem is we can't regulate where someone consumes it. So if we sold marijuana at location X, which is approved, and someone is smoking or eating that marijuana at location Y, there's nothing we can do about the consumption. And I think it was a good point on the whole marijuana truck, as far as smoking in the truck. I mean, it's not, I don't know how zoning would regulate that. I think it would have to be through an ordinance with the police department.
Okay. Like through your town council or your board of selectmen?
Yes.
Yes, thank you.
Could I ask one quick question?
Sure.
Christina, could we use town ordinances to also address the issue of content on signs?
No.
So we can't touch that at all.
It's freedom of speech. So, I mean, I've had people put signs saying, F you neighbor next door. And I've had a hard time enforcing it, and I have to be careful because that's their opinion and that's freedom of speech. It's your constitutional right. So the same thing with pictures and so forth. So you can minimize the sign. So if your town was to have a marijuana dispensary and it was allowed, you can say the sign can only be 2 square feet for that use, but you can't regulate the color or where it says only the location, size, and how high it is on a post.
Okay, thank you.
That's good information to have. Thank you, Chris.
You're welcome. And I don't know, I think the ordinance would have to take care of a ban. I mean, I don't know how, it's got to be impossible to regulate people smoking in a van. It would have to be through the police and an ordinance. Same with delivery. That's another tricky one. I mean, the one thing you have to think about with zoning is it's related to the land. So when you have something that's mobile and it's not a brick and mortar business, it's tricky because it's not, it moves. So you could have a business van permitted in Portland and it drives to Old Saybrook and is selling that product. So I think it's probably easier for towns to go through an ordinance than zoning.
Am I the only one who thinks about the fact that the driver of that bus has to be stoned? That's one huge contact high there that would be impossible to avoid with a bunch of people smoking up the rest of the bus.
Good point, David.
Maybe he's in a moon suit, you know, the bubble.
He's got his own oxygen hose. Any other questions from anyone?
I have a question. My name's Carrie Duquesne. I'm fairly new to the town of Essex. So I came here from North Branford, and probably 2 or 3 years ago, North Branford had a moratorium in place. So I'm wondering if there are any towns that have moratoriums and are kind of taking advantage of that just while we kind of figure out where everything lands.
I'm unfamiliar with it. I don't know the answer to that question, but I do know from having read up on Massachusetts that there were many towns that put moratoriums in place for a couple of years to ban all marijuana activity and sales, so that they could have a couple of years to study it in Massachusetts and see how it goes. So it's kind of a temporary, couple year thing, that which I think some towns had more of an appetite for that than they would have otherwise. So,
right. Okay. Thank you.
This is Bo Hune in Guilford. On the medical marijuana issue, I know there were a number of towns with moratoriums. In Guilford, we went for an outright ban, and the zoning board did grant that and changed the regs to ban it here.
And in Clinton, we too had a moratorium on the medical marijuana. Unfortunately, no one was able to make it today, so we could bounce it off of them at the moment. But if you wanted to reach out to, our town council chair and just see what they might be thinking of to do that, they might have an answer for you.
Okay, thank you.
Any other comments on that or any other questions?
well, thank you everybody for coming today. And as you bring this issue to your communities, just know that your youth service bureaus and your prevention coalitions are here to come to town hall and meet with you and educate anybody and help you with this. So we want to be part of the process. And we will be emailing out to you the slides and some data that were referenced today during the presentation. So thank you.
I would like to thank my colleagues from throughout the region who did an excellent job. Thanks, guys. This was great. And also our guest speaker, Marinas, for being a part of this. Good job.
Absolutely. Thank you guys all for coming. Good luck with it.
Thanks a million.
Thank you, everyone.